Welcome to the ADAA webinar, Your Anxious Brain on Drugs. I am Dr. Jenny Yip, Executive Director of the Renewed Freedom Center for Rapid Anxiety Relief in Los Angeles, California, and Clinical Assistant Professor of Psychiatry at the USC Keck School of Medicine. And I'm a member of the ADAA Public Education Committee, which has produced a series of monthly webinars. On the right side of your screen, you should see a Q&A panel. There's a little field at the bottom of that panel, and when you click in it, you can type in a question. Then hit enter, hit the enter key or click the icon. You should be listening to this through your computer speakers. You do not need a telephone connection. If you've dialed in, please hang up and turn up your speaker on your computer. You can ask questions at any time, and we'll try to get to as many as possible. Other participants cannot see your questions. We may not have time to get to your individual question, so we apologize if that is the case. We are recording this webinar to make it available on the ADAA website at a later date. Today, we'll be hearing from Dr. Catherine Pittman, clinical psychologist, Chair and Associate Professor of Psychology, St. Mary's College, Notre Dame, Indiana, co-author of Rewire Your Anxious Brain, How to Use the Neuroscience of Fear to End Anxiety, Panic, and Worry. Dr. Pittman practices evidence-based psychotherapy, which means that the approaches have been tested and shown to be effective. She focuses on understanding how the natural processes of the brain and body can be changed to improve one's life. She specializes in treating anxiety disorders, OCD, and mood disorders such as depression, as well as assisting in recovery from brain injury or stroke. Before we begin the presentation, I'd like to tell you about ADAA. It is the leading nonprofit dedicated to increasing awareness and education about anxiety disorders, depression, OCD, PTSD, and related illnesses. ADAA's mission is to improve diagnosis and promote the prevention, treatment, and cure of these disorders through education, practice, and research. ADAA fights to end stigma by promoting the message that they are real, serious, and treatable. Please visit the ADAA website, www.adaa.org, which includes Find a Therapist, a searchable database of treatment providers, as well as free educational information and resources, self-tests, self-help groups, clinical trials, and a lot more. Please support ADAA's efforts, such as this webinar series, by making a charitable contribution on the ADAA website. Remember, you can type a question at any time. Now, let me turn it over to Dr. Pittman.
Thank you so much, Jenny. I really appreciate all that introduction, and I really do encourage people to support the ADAA. I'm wanting to stay on this screen right here for a minute to point out that my email is at the bottom of the description of myself there, and to let people know that I really will try to answer questions that people have if you do post them. But you can also contact me via email after the webinar if you're interested in having some further dialogue about something that was discussed. I'm really willing to do that. So just notice that my email is cpittman@stmarys.edu. As we begin this webinar, I want to point out that we start with a question, and this is an important question that we need to ask. When you're taking medication for anxiety, what are you hoping to accomplish? Are you hoping to get relief, or are you hoping to correct the problem? And if you take an example, people who have diabetes, for example, take insulin, and that insulin replaces the insulin that should be made by the pancreas, and that corrects the problem that the individual is having. When you take medication for anxiety, you should always try to consider what's being accomplished by taking that medication. And some people are simply focusing on the idea of getting relief. let's say you're looking for relief. And take the example of if you have a toothache and you take ibuprofen, and that reduces the pain and that provides relief. But if the pain is due to a cavity or a cracked tooth or an infection, you really haven't corrected the problem. That's why the question when you take medication for anxiety, what are you looking for? Are you looking for relief or to correct the problem is an important question. Getting relief does not necessarily correct the problem. So this perspective is a very important one to keep in mind, and that's because anxiety is one of the worst sensations, the worst feelings that a person can have. And it's very easy to have your focus change to simply reducing it quickly and getting rid of that feeling. And getting a temporary break from anxiety is really such a great relief that can feel like a solution, and people don't consider the big picture. But imagine if you went to your dentist and you had a painful tooth and the dentist said to you, yes, that hurts, and then gave you some medication for the pain. That provides relief, but it doesn't solve the problem. And it could be you need a filling. It could be the tooth should be pulled, or there's an infection and you need antibiotics. So the important question here is to identify what it is that you're trying to accomplish with the medication that you're taking. The point being that we do have effective ways that we know to change the brain to be less anxious. And you need to know how it is that medication can fit into this process. So let's consider anxiety medications for a minute, because they're not all the same. Some of the medications that we'll be talking about later in this webinar are addictive. That means that as you take them, you need more and more of them for them to continue their effectiveness, and you don't feel that you can be without them. Some medications take longer to work than other medications, and you're waiting for their effects to occur. Almost all medications we're going to talk about have side effects that may be more or less troubling. And some of the medications that we'll be talking about have negative long-term effects and are really intended for limited use, not for daily use. So some medications, they will actually work better if you know what that medication is trying to do and you can work with that medication. So you know, for example, when you're supposed to take the medication and what you are supposed to do in order to make that medication more useful and more effective. Your brain, your anxious brain, is able to change to be more resistant to anxiety, and some medications are going to help you accomplish this. But honestly, there are some medications that don't help in changing your brain. So what you're going to learn in this webinar is, first of all, that the brain is changeable. It has a quality that we call neuroplasticity, and that means that you can change the way that your brain functions no matter what your age is or how long you've dealt with anxiety. There are ways in which you can actually change that brain. Anxiety involves two pathways in the brain, and we're going to be talking about how each of those pathways is important to understand if you want to effectively change anxiety. And there are very practical ways that you can change each pathway, and those changes really are making your brain more resistant to anxiety, and some medications will help you in the process. But I want to stress that medication is not always needed for your brain to become more resistant to anxiety. So let's talk about this idea of changing the brain. If we want to reduce anxiety or control anxiety, that requires us to change this mass of tissue in our head. And what is that made up of? Well, it's really made up of cells that are connected, and there are billions and billions of connections between those cells, which we call neurons. And changing those different connections is the very best way to change the processes that create anxiety. If we want to want the brain to resist anxiety, those connections need to be modified in certain ways. Now, unfortunately, I have to tell you that there's no medication that we know that can actually change those connections. And that means that you are going to need to do some things in order to change the connections. But medication can help the process of trying to change those connections in certain ways. One way that medications help is by slowing down the connections that lead to anxiety, so it inhibits the connectivity between those cells called neurons and makes the messages slow down and less likely to be communicated from one neuron to the other. And another way that the medication can help is by promoting the development of new connections, like building new roadways, new pathways in the brain that help the brain operate in a new way that resists anxiety. But remember, when you make changes in your brain, it doesn't necessarily mean that you need you need medicine in order to make those changes. Now, what do you want to change in your brain? That's an important question, and that should be a question that you consider before you are seeking medication. We identified that there are two different pathways that are involved in anxiety, and these two general parts of the brain are the areas that we want to focus on the connections in those areas of the brain, and those are the areas we want to change. One part of the brain that's called the amygdala is involved in producing the anxiety response. The other part of the brain that we want to change is the cortex, and the cortex is where thoughts that produce anxiety start, and then those thoughts may activate the amygdala. And it's the amygdala, however, that actually produces the anxiety response. And we want to take a little closer look at this. First of all, in this illustration of the anatomy of the brain, you'll notice on the left side there is the cortex that's made up of the different lobes. It's that curvy part, the largest part of our brain. And the cortex is the thinking part of our brain. The amygdala, on the other hand, is actually a very small part. It's actually technically two very small parts, one on the left and on the right. And if you look on the right side where you can see inside the brain, you'll see a very small, right in the middle, about the size of an almond. And the amygdala, actually, that word means almond in Greek. That is the amygdala. You have one on your left side and one on the right side in your temporal lobes. So that's where they are in the brain. And you're going to probably thank me that that's the most you need to really know about brain anatomy. But let's talk a little bit just in layman's terms about the amygdala. You know, one of the best ways to think about the amygdala is to think of it as an alarm system. Instead of hearing this alarm like you might with a smoke detector, you actually feel this alarm. So when you are feeling anxiety, you're having a sensation, your heart pounding, a tenseness in your muscles. The feeling that you're having is the alarm going off. Now, what it is that you're experiencing is really the fight or flight response, or more appropriately called the fight, flight, or freeze response. The amygdala is what starts this response. When it feels some kind of threat or danger, it sets off this response, which involves hundreds of different changes in your brain and in your body that happen in a fraction of a second. Everybody has a brain that is hardwired to allow the amygdala to take over and to just seize control under certain circumstances. Now, what happens when that fight, flight, or freeze response occurs? Well, first of all, your muscles often tense, your heart pounds, your digestion stops. You can't think about what you want to think about. Your attention gets focused on certain things. And by the way, this happens even when other parts of your brain do not want it to happen. And when other parts of your brain don't see any danger and don't believe that there's any danger, your amygdala can still create this type of an emotional response, a physical response. Now, the amygdala is not a logical part of our brain. It doesn't respond to reasoning or explanations. And one of the things that I often tell my clients, I'll say, everything that I'm talking to you about now and everything I'm explaining to you now is not affecting your amygdala in the least. It is not responding to the logic of what we're discussing. How does the amygdala learn? It needs experience to learn. It has to have some type of experience. That means it needs to go through something. And why do we care about how the amygdala learns? Because we are going to want to teach the amygdala not to respond in the way that it does. And this is how we try to correct an anxiety difficulty, by changing how the amygdala responds, by teaching it new ways to respond. So the amygdala is also the part of the brain that turns what used to be just a normal, average, neutral situation into a trigger for anxiety. So certain objects or sounds or situations that previously might not have caused the person to feel anxiety suddenly start creating that emotion. And the amygdala is where that learning occurs and where the change happens in a person's brain. So that a person who used to be able to sit in the passenger seat of a car calmly after an accident has a lot of difficulty sitting in the passenger seat of a car, feels very anxious, and it's due to changes that happened in the amygdala. Because scientists have learned how and where those triggers are created in the amygdala and learned about how to train the amygdala to stop responding to triggers like that, we can make use of that information. Now, on the other hand, the other part of your brain you need to be considering when you're thinking about dealing with anxiety is the cortex. And the cortex is the curvy, gray top part of your brain, the one that we think makes us the most human. It's the perceiving and thinking part of your brain where what you see and you hear is interpreted into meaningful things, so that when you recognize who someone is or you understand what someone is saying, it puts together all that information to enable you to understand the world around you. And it attaches meanings and memories to the perceptions you have, so that you recognize things and understand the words people are saying. So it provides you with ability to understand what's going on around you. And it's where we have our logic and our reasoning. We can understand language. But also, and this is wonderful about our brain, that we can use our imaginations and we can plan ahead to ways we're going to respond to a certain situation, which is a very good skill to have. Unfortunately, this ability to anticipate and to imagine the future can also cause difficulties for us, because we can imagine things and we can anticipate things that create anxiety in the amygdala, that promote that anxiety response produced by the amygdala, and that is the drawback. So we're going to get to those. We're going to get to those later. Let's go back to the amygdala, and we're getting to this because we want to understand how medications might help us or they might not help us. So we're getting back to this idea of changing the brain, making it more resistant to anxiety. Take just the amygdala for a moment. How do we want that to change? Well, let's say we are dealing with someone who has maybe a public speaking anxiety, where when they need to speak in front of a group, they're anxious and they have difficulty with that. Well, we want the amygdala to react less to that kind of situation. We don't want it to create the bodily reactions and the emotional feelings that we have. We want to be able to be around triggers like perhaps maybe a friend's dog without having such a feeling of anxiety that you want to run away or that causes you a lot of distress. So what we do is we want to find ways that we can reduce the activation in the amygdala. We want to calm it down. Remember those connections in the amygdala? We want to find a way to inhibit the connections that are happening in the amygdala. And you might be surprised to learn that medications are not the only way to reduce amygdala activation. Actually, there are certain ways that we know from studying, from a variety of studies, that will reduce amygdala activation. And one thing, which doesn't cost any money and has no side effects, is deep, slow breathing. Another way that we know that actually reduces the activation in an amygdala that's activated is muscle relaxation. These are all things that you can use when you're feeling anxiety that actually work quicker than many medications. Meditation is another way that reduces amygdala activation. Exercise, if you go for a run, you'll often find that your anxiety level drops very quickly. And then also medications. There are medications that inhibit activation by blocking some of the chemical reactions that happen between neurons and making it less likely that those cells will react. So research has shown that all of these approaches can change the activation in the amygdala. And this is explained, in more detail in a lot of different books. There's a lot of self-help books and different things we can talk about that can explain all these different ways. And so how do we want to change the amygdala and prevent it in a different way now from becoming activated? So we're really talking about prevention here. What if we want our amygdalas to be less likely to react? Well, there are things that you can do in terms of some changes in your lifestyle that tend to keep the amygdala calm so that it doesn't react. And these are very helpful in preventing panic attacks and resisting compulsions. And these things, once again, are not simply medication. For example, adequate sleep has been shown to reduce the activation in the amygdala. And by the way, reduced sleep, which women and men often have after they have children, babies, really increases a person's anxiety because they're not getting adequate sleep. So the reverse is true here. You can create more anxiety by getting less sleep. Also, regular cardiovascular exercise makes amygdalas less activated in general, just over the week or so or month in which you're having that exercise. You can also teach your amygdala to respond differently by using exposure therapy, in which you give the amygdala experiences. Remember, the amygdala needs experiences to learn. Give it experiences by exposing it to certain things that it often reacts to in an anxious way, and teaching it to respond differently. There are also medications that promote new connections in the brain, and those things tend to make the amygdala less likely to become activated. And then finally, there are medications that directly inhibit the amygdala, as we noted before, and make the amygdala, it's kind of like sedating it or putting it to sleep. Now, the final approach, the medication that inhibits the amygdala, this is the one that produces probably the most immediate relief when people are seeking treatment. And the other ones take a little longer often, and that is why certain people feel like if I can take a medication that immediately causes me to feel, well, I'd say 15 minutes or so, causes you to feel relief, it's very tempting to think that that is a good solution because it's keeping the amygdala from reacting. It's preventing the fight or flight freeze response from occurring. And that just sounds great to people, and actually it can feel great. But the problem is taking medications that inhibit the amygdala can actually make changes in the amygdala less likely. So if we're trying to change the amygdala, to teach it something, if we're trying to make lasting changes, then we don't want to just inhibit it or put it to sleep with medication. We want to actually teach it something. Now, I'm a professor, and I can assure you that when I look at my students sitting in the classroom and I see some of them sleeping, and I really do see some of them sleeping, I know they're not learning much in that moment. And that's the way the amygdala can be if you use certain medications. Okay, let's turn to the cortex for a minute. How do we want to change that so that we can know what we're doing with medications in this case? Well, first of all, remember we said that the cortex sometimes produces thoughts and images that on the basis of our ability to plan ahead and anticipate. And it can create images and thoughts that cause our amygdalas to become activated when if it had just been thinking about pleasant things, the amygdala would have not have responded at all. So some of the things we want to do with the cortex is we want to stop the production of worries that are focused on what could go wrong. So if a person's thoughts tend to go in the direction of anticipating what might go And sometimes we have expectations that really increase our stress. So we think that someone's going to get angry with us, or we believe that something is going to go wrong in a project we're working on. And those expectations that we create in our brains are things that we want to be aware of. Then we might also imagine scenes of disaster or danger or anticipate things that might happen. One of my favorite ones that I have to deal with is when I have teenage daughters and they're out driving in this snowy weather that we have here right now in Indiana. I can have all kinds of terrible thoughts of what might have happened to my daughters, and it creates a lot of anxiety in my amygdala, but it starts in my cortex with those imaginative scenes that I create. So the idea here is in the cortex, we want to stop focusing on the negative and stop also assuming that our thoughts or our worries are going to predict the future. They're just thoughts and worries. One of my favorite quotes from Mark Twain, he said, "I've lived through many distressing events in my life, some of which have actually happened." And I think that's a really good way to remind ourselves that our brains take us into scary places that really don't ever actually exist sometimes. So, important thing here then with the cortex is that we want to, I'm sorry, I went a little too fast there. How do we want to change the cortex? Well, first of all, therapy that's focused on examining the thoughts that you tend to have and evaluating them and changing your thoughts, therapy that we often call cognitive behavioral therapy, CBT, and other therapies that do similar kinds of things that encourage you to think how you're thinking, think about how you're thinking. And self-help books, for example, that suggest new ways of thinking, and sometimes this just reading about things or going to therapy isn't enough. Sometimes you have to remember that you have to practice these ways of thinking. You have to make sure that you interrupt certain thoughts, and some of these techniques are called thought stopping, where you literally tell yourself, stop, don't think that, and then you can change the channel, think about something different. So myself, the example I gave you, if my daughters are out and I'm worried about them driving around in bad weather and I'm having imaginative scenes in my mind of them being in accidents, I need to change the channel and focus on something else. Also, cognitive diffusion, which is to remind yourself that your thoughts are not the same as reality and that you can have all kinds of thoughts that don't lead to reality. And then positive imagery, where you imagine positive things happening. There are definitely medications, too, that tend to increase the flexibility in your thinking and that help you to change your thoughts and shift to new perspectives. All right. In terms of the cortex, there's a rule that I like to remind people of. One of the ways of changing the cortex is to remember the rule of the survival of the busiest. Survival of the busiest. In the cortex, whatever circuitry you use the most becomes the strongest circuitry. So if you worry the most, you're exercising the worry parts of your brain. But if you use parts of your brain that produce positive images, you're going to be strengthening those parts of your brain. And whatever survives in your brain and gets used the most is what you use the most, what you keep the busiest. So when you interrupt and you change your thinking, you are actually decreasing the likelihood of certain thoughts and increasing the strength of the thoughts that you are thinking. You're changing the brain. And I just want to remind people that there are all these techniques, and I put on here just a little picture of the book that I wrote with my co-author, just to remind you that you can rewire your anxious brain, and there are many, many, many techniques that therapists and self-help books can tell you that you can use. Our goal overall here is to make the brain more resistant to anxiety and to definitely keep in mind that you have lots of different techniques that can be used. But let's go back to this question of how medications fit into the big picture. How do we use medications? Well, medications by themselves, remember, do not provide the learning that your brain needs to actually weaken patterns of responding and build new kind of pathways. There's not a pill that you can take to change your brain's circuitry in the way that we're describing. We need to change it. In fact, Some medications are going to actually interfere with the brain's ability to change itself. And by putting parts of the brain to sleep, these medications are going to make it less likely to change. For that reason, you really need to be careful and go beyond just thinking about the short-term effects. Like when I take a medication, do I feel better or not? You really want to know, what is it this medication is doing, and is it helping me change my brain to make it more resistant to anxiety? So now we're ready to examine the way that we can look at some common medications and how they affect anxiety. Now that you have this background where you know what we're trying to do. We're not trying to go backwards, we're trying to go forwards. Okay, going forwards. The common medications for anxiety, really you can divide them into 3 groups. There is a group that we're going to refer to as the reuptake inhibitors, although most people call them antidepressants, but that confuses people because they're not only for depression. So calling them antidepressants can really lead people to be confused. These reuptake inhibitors are often called SSRIs, SNRIs, and that stands for selective serotonin reuptake inhibitors or serotonin norepinephrine reuptake inhibitors. These medications have what they do is they actually block the reuptake of certain chemicals called neurotransmitters that are involved in communication between neurons. Now think about that for a minute. If you block something from being taken up again, what that means is it allows it to stay out there more. So basically it's causing there to be more either serotonin or norepinephrine in between the neurons and promoting more communication between the neurons. So that's what those things are. When you see someone talk about SSRIs or SNRIs, they are putting chemicals into the brain that are normal chemicals that we have in our brains. They're just increasing the amount between the neurons and promoting more communication. Then there's also the benzodiazepines, another type of medication that we'll talk about, and beta blockers. And beta blockers and benzodiazepines, their names don't need so much explanation as the SSRIs and SNRIs. All of these, though, have their effects on neurotransmitters, the chemicals that the neurons use to communicate with each other. So let's start by talking about the reuptake inhibitors, the SSRIs and SNRIs. These are the medications that are typically considered the best approach of any medication to treat many anxiety disorders, and that's why they're called the first-line treatment. You can see that the names of some of the common ones. Based on research, these are ones that have been studied, whether you're talking about Zoloft, Prozac, Celexa, Lexapro, Paxil, all SSRIs that have been used in treatment of many different anxiety disorders. And then there's also the SNRIs, Effexor and Pristiq and Cymbalta are all SNRIs that affect not only serotonin but norepinephrine. And once again, just how do they affect the brain? What is it that they do in the brain? An important question we want to know. They block reuptake, meaning there's more neurotransmitter or the chemical messenger, the communication messenger that's available to the neurons. So they promote more communication between neurons. And both the cortex and the amygdala seem to be affected by these kind of medications. Now, importantly, though, if just giving a person more presence of a neurotransmitter in their brain corrected anxiety, then we would say that we should see changes right away. But that does not seem to be the case. It seems that these medications take 1 or 2 weeks to even see an effect. So they don't provide quick relief. So this is frustrating to many people where they feel like, okay, I'm taking this medication, but today I'm not feeling any different than I did yesterday or the day before, and I'm not sure that they're having any effect. And in fact, because they cause your brain to have some additional chemistry in there, sometimes there's even a worsening of anxiety that occurs at first, so that people have to go onto these medications gradually, taper their way up gradually. They do assist with insomnia, which is a good thing, but they're not going to act in a quick way. So what is it that they do? Well, on this next slide, I tried to summarize what we hypothesize, what we think is affecting, what we think are the effects, of the SSRIs and the SNRIs. What we think happens is that these higher levels of serotonin and norepinephrine in the brain, they stimulate the neurons in a way that eventually, it doesn't happen immediately, but after about 10 days or so, they start remodeling themselves and their circuitry in a variety of ways. So we're talking about change in the brain. And as the neurons change, they grow new dendrites or kind of branches, and they develop new connections or circuits. And if you're thinking, wait, that sounds good, that sounds like something I might want, that is true. These are medications that can increase the flexibility in your brain, and that can help us change some of those things in our cortex and our amygdala that we might want to change. Now, I do want to tell you this process is really not well understood, and it's hard to say really down, to the level of molecules, what's going on, but a good way to think about it is just increased flexibility in the brain. And these medications have been shown to work well when you're in a kind of a therapy that's trying to get you to change your thought processes. They seem to help facilitate that process. Well, are there detrimental effects of these medications? Yes, there are side effects that occur, and that's really because serotonin and norepinephrine are not just things that are in the brain, but these chemicals are in our whole bodies. So there's side effects that you see listed here that often go along with these medications, including people find some of the most difficult things, weight gain or loss, and some initial anxiety or change in your sex drive. And also another thing I should point out, a detrimental effect, is that you can't just go off of these medications quickly once you've been taking them. You get headaches and flu-like symptoms and insomnia. This is something that changes how you're going to feel for a couple days, not for a long, long time, but they're not something that you should go off really quickly because your brain gets accustomed to having them there, and the rest of your body too, and you need to kind of adjust to a lower level. All right, well, let's look at the benzodiazepines here. Now, these medications, I'm sure you're going to recognize the name of Valium or Xanax, Ativan, Klonopin. These are tranquilizing medications, and they inhibit activity in the brain. What they do is they are going to calm down the amygdala and the cortex, but it's mostly the amygdala that is what we notice as changing. And this relaxes your nervous system. It relaxes the person. But unfortunately, when we look at how they affect the brain, because the brain's activation level is lowered, its ability to create new connections is lowered. That's the way the brain learns things. And as I said, when you're sleeping, you don't learn too much. And so benzodiazepines actually decrease the effectiveness of some kinds of therapies, like exposure-based therapies, and they've actually been shown to even interfere with some cognitive therapies. So how do they affect anxiety? Now, in this case, people are often very happy with the results because they tend to provide fairly immediate relief. In less than an hour, you're feeling better. They can assist with insomnia also. And if your goal is to reduce anxiety just at a specific time, like when you need to ride the train, which isn't very often, or if you have to cope with the fear of the dentist twice a year, just, short periods of time, occasional use of benzodiazepines might be useful. But when you use them every day, they can have some very negative effects. And these are the detrimental effects we have to think about. They affect a certain neurotransmitter called GABA, which is used in almost every single part of your body. So they really affect many different processes throughout the body. And because they're tranquilizing, they interact with alcohol in a dangerous way, and you have to be really careful about that. And they cause side effects such as muscle weakness and sedation, and they can cause cognitive difficulties, impairing your thinking skills or impairing your verbal learning and memory. Now, occasional use, meaning every once in a while, doesn't really pose any kind of addiction risk, but they do have a very high potential for abuse and addiction, and that's when they're used daily. Even when they're prescribed daily, and that's the way the doctor intends you to use them, if you use these medications longer than 4 or so weeks, physiological dependence can start, and that means you start to need a higher and higher level of the medication. You adjust to them, and you're going to have some pretty severe withdrawal when you try to come off of these medications. And the withdrawal symptoms, by the way, are withdrawal symptoms that can last for months. I did a study in which we asked people to report how long their symptoms lasted after they stopped taking benzodiazepines, and the average number of months was 14 months, where people still continued to feel like they were having agitation and rebound anxiety. And sometimes they would say, my anxiety after getting off benzodiazepines was worse than it was before I ever started using it. So these are medications that don't necessarily have good long-term effects. Then finally, we're going to talk about beta blockers here. And beta blockers, they don't reduce anxiety itself, but they block the symptoms of anxiety. So they reduce symptoms like trembling or heart rate, and they have effects on the brain in which they keep the amygdala from being able to produce that fight or flight response. They don't produce lasting changes in the brain, though. They only are working when they're present in your system, and they don't reduce the experience of anxiety, like trembling and sweating and heart rate increases, but they really don't. You still are anxious, but you're just not feeling so much of symptoms, so they're kind of reducing the symptoms. And they can have some detrimental side effects. They aren't addictive, but you do have to come off of these medications slowly, too, because your body gets used to having them, and your blood pressure and heart rate can really go up if you come off them very rapidly. All right, so here are recommendations for you. First of all, if the goal is to change the brain so it's more resistant to anxiety, and that's what you're hoping to do, then if we look at the benzodiazepines, those medications are best used occasionally, where you use them as needed, not on a daily basis, and that you should not use them for an extended period of time on a daily basis. For example, don't go beyond 4 weeks or so of using them every day. And if you read the recommendations, you actually read the advice that's given when you get the medication, the information that comes from your pharmacist, you will see this warning on there, not to use them on a daily basis for an extended period of time. And extended, by the way, is this 4 to 6 weeks. Now, benzodiazepines then are best for coping with some kind of time-limited situation. Like if you're going through a bad divorce and you need something to take before you go to the divorce proceedings, or you're not driving and you are riding with someone and you're nervous about that, that just every once in a while. But if you're trying to use them to drive every day to work and relying on them every day, that's when they become a problem. Now, beta blockers, they're also useful for specific situations when some kind of symptom like trembling are the primary difficulty and you want to reduce that kind of symptom. But it's really the reuptake inhibitors like the SSRIs and SNRIs that are the medications that we really say are useful in the process of changing patterns of thinking and responding, and they are the ones that you can kind of think of them as kind of a fertilizer that helps promote change in your brain. They don't just work by themselves in the sense of taking them. It really helps to have someone help coach you, like what thoughts should I be trying to grow? What thoughts should I be modifying or eliminating? And these are some of the questions you should ask your doctor. Ask your doctor when you're talking about medications for anxiety what the goal of the medication is. Is this for temporary relief until other approaches are effective, or is this something you're expecting me to take every day? Is this going to be for an extended period? And then ask about addiction potential. Ask what you should do to make the medication most effective. How often should you take it? When shouldn't you take it? And what should you be doing to get the most benefits from it? And if the medication's a benzodiazepine, which we know are addictive, ask the doctor, how you can make sure you use it in a way that prevents that kind of dependency. And also remember to ask about approaches other than medication that can help you manage your anxiety. And then finally, importantly, none of the medications that have been talked about today are medications you should come off of very abruptly, because difficulties can result in any case. Every single medication we've talked about, if you've been using it daily, should be reduced by gradually coming off that medication. And what happens when you stop taking benzodiazepines is typically your amygdala and cortex return to the usual anxious responding that they did before. It's unlikely that you've changed the way your brain is responding. And also there, as we said, the withdrawal, if you've used it for 4 weeks or so, and some people have used these for years, withdrawal can be very difficult. When you stop taking beta blockers, the anxiety responses of trembling and sweating and increased heart rate come back. They don't change. But we actually, when you use the SSRIs and SNRIs, those changes in your thinking and responding are more likely to be retained in the case if you've taken those medications, especially if you continue to practice the new thinking and behavior patterns. Remember, the survival of the busiest. Whatever you use the most, that's what is going to be likely to last. And so I'm very willing to answer more questions people have. You can send me an email if you have questions and want to ask. My email is cpittman@stmarys.edu, and you have to spell out the St. Mary's, S-A-I-N-T, Mary's.
Well, that was certainly a lot of information and very enlightening for some of these questions that many people have been wondering about. I have a few questions coming in.
Okay.
I'd like to get the Q&A started. The first one is, if you have anxiety and are depressed to such an extent that you cannot focus or make decisions, should you get medication to quiet the anxiety so that you can make rational decisions?
Well, I definitely think that you do remember that there are many ways to reduce anxiety besides medication. So I really just ask the person, if they're willing to use medication, I would recommend, once again, the SSRIs and SNRIs are things that they tend to affect both anxiety and depression, both of those. And those are the ones that are the first line of treatment. Staying away from the beta blockers and benzodiazepines is probably a good idea. The benzodiazepines actually, in being tranquilizing, they tend not to help improve your thinking process so much. They do get the anxiety out of the way, but they kind of slow down the whole neurological system. So, but these medications have really helped people. It's like a fertilizer. When I say the SSRIs, it's like a fertilizer in your brain that helps promote growth and change, but you have to be involved in it too. So you don't want to count on the medications as doing the change for you. It's a combination of the effort of you trying to grow new thinking patterns at the same time you have that fertilizer of the medications in your brain.
Okay, all right. So in other words, depending on your brain to do the work rather than the medication.
Right.
Okay. Here's another question. And you've already answered this, though there might be more that you can add to this. This question is, how can yoga or any relaxing exercise tailored to an anxious brain affect the wiring?
Okay, so what you're doing in general when you do yoga, that you notice how there's lots of breathing and stretching and relaxing of your muscles? What we found by doing MRIs and watching people who are lying in an MRI machine and we're able to see it in action, the amygdala in action, deep breathing and muscle relaxation actually changes the activation level of the amygdala. And by reducing the activation level of the amygdala, you're going to make it less likely to send out those messages that you need to have an alarm reaction. And as you learn how to relax your body and slow your breathing down, what we find is that people can naturally start to be in a more relaxed state. And they didn't realize they had the ability to do this. people often say, yoga has changed my life, and it's because it changes the activation level. It kind of resets you to a lower activation level by doing that kind of thing.
It's kind of like exercise is the opposite of the activated mind.
Well, and the funny thing about exercise, though, exercise, you might think, well, when you're exercising, is that the opposite? It would activate your brain. But exercise, it seems to be part of the fight or flight response. And when we exercise, it's as if we've completed a circuit. Like the job of our amygdala is to get us to run away. And if we do something active, it kind of resets the mechanism like, okay, we're safe now. Even though this is not logical. And people often try to say, what is that? That's not logical. But it's not the amygdala is not logical. If you just try this sometime when you're feeling anxious, go and exercise. And you will say, why do I feel better? Nothing changed. And about, my mortgage is still not paid, but I feel better. It's the funny thing about the amygdala that it responds to exercise.
So it's very counterintuitive.
It is. And, this is the thing. Anxiety causes us to do certain things that make perfect sense why we're doing them. But some of the best things that help us cope with anxiety are counterintuitive things that we've learned by studying how the amygdala is actually connected with the rest of our body and how it reacts to these things.
That's some great insight there. Here's another question that I have many patients with who are suffering the same. So this one says, what if you have been on benzodiazepines for the better part of 30 years?
Yeah.
That's a long time. And now they are trying to take you off of them.
Well, honestly, I think that is very wrong because you have a certain type of brain that has been adjusted to these things, and I would never, ever try to take a person off those medications in any kind of abrupt way. It has to be so gradual, and I'm talking about gradual in the realm of years if you've been on it for that long. And honestly, I've worked with patients that have decided not to try to get off of them because of the negative effects, and that's why I'm really trying to warn people about taking them and getting started with them. But if you have been on them, honestly, what I'm telling my patients who are on benzodiazepines who have tried to get off them and have had really negative responses to coming off them, I am really honestly telling them we need to wait until new medications are developed because they are working on it. But it's not a person's fault that they become dependent on it. They usually were taking the medication just the way the doctor told them to take it, but they've developed this dependency, and their brain is used to having that low level of activation, and it starts to adjust, and it adapts to it and needs higher and higher levels, and you just can't take it away without a lot of negative reaction.
Does it make a difference whether it is a child, a 10-year-old child? Well, I don't know who would prescribe a 10-year-old child benzo, but let's say a teenager, a 16-year-old teenager who started this drug and who's been on it for a number of years versus an adult in their 40s who's starting on this drug.
I do not know of any differences with regard to that. I don't know of any evidence that it's different. I do know that it varies from person to person, and there are probably more complex issues involved in mediating variables that we know. Just like, for example, why are some people more sensitive to alcohol than others, and why do some people, seem to be able to stop smoking? So, I mean, there are just complicated things about the addiction process in the brain that we don't completely understand, and I'll just admit that. And tell people, if you try to come off of these medications and you have a very negative reaction, first of all, that's not in your head. That is really happening. And I wouldn't force a person to come off of them. And I have heard of doctors who have thought the best thing to do is to stop prescribing, and I don't think that's a good idea.
Okay. All right. So here's another great question. What do you think of add-on drugs, for example, like Abilify for anxiety depression?
Well, I'm not a psychiatrist and haven't gone into the level of training that they have. I've really worked more with anxiety and changing it through changing people's behaviors, and I've seen how the medications help or they don't help. And I don't feel too qualified to say that I have any experience that has encouraged me to have people go that far. I mean, Abilify, these medications are really pretty strong medications. And I try to stay, in the shallow end of the pool when it comes to the medications because we know other techniques to change. So now, on a case-by-case basis, I think if people feel this has helped them, I'll listen to what my patients tell me, but it's not something I would encourage.
And we actually have a few more minutes. However, we've got several questions about dosaging and what you would do. So I would encourage listeners to inquire with their psychiatrist.
Yes, that's what I would say, because I'm a psychologist and I did not study all the dosing. Really what I'm able to talk to you about is what we know about changing anxiety in the brain, because I've studied the brain and studied the therapeutic interventions, and then how medication interacts with that. And I do encourage people to read what it says on the information sheets you get with your medication. You really should look at that because it gives you an idea of whether there is an expectation that you're not going to be using this medication. And I've heard people tell me, no one ever told me I should not use this every day. And the benzodiazepines are an example of something you really should not use on a daily basis.
Okay, that's a great point. Okay, here is another question. Okay. I have a question about research which has shown that SSRIs don't work any better than placebo. Can you please address this research?
Right. Well, one of the things that we are seeing in our culture right now is an increase in the placebo effect. This is really an interesting thing that's happening. That is, people are, the placebo effect is when you take a medication and you feel better simply because you're taking a pill, not because of anything that's active in that medication. So you could be taking, a sugar pill, something that has no active ingredients, and you feel better. We're really seeing that not so much that the medications are losing their effectiveness in some ways, but that placebos are gaining effectiveness. And that is what is very interesting. And you know what I think it is? I think it's all the advertisements on television that tell you, if you take this medication, you could have an erection that lasts for 4 hours. We're starting to recognize these medications are very powerful, and we believe something's going to happen, and especially with anxiety. If you have a sense that you're going to feel better when you take a pill, surprisingly, it can simply be the placebo. But I want to let you know, the medications I'm talking to you about are not medications that do not have an effect neurologically. They actually do have effects. And every person is different, and some medications work better for one person, and some, there's cultural or ethnic differences in how we digest medications, how our liver metabolizes them, and so you may feel like this medication really helped you with your anxiety, and someone else said that didn't touch my anxiety. That doesn't mean that you had a placebo effect from your medication. They do have an effect, but they're different for different individuals, and placebos do have an effect. And so I hope that kind of explains why we might be finding some people who say that medications aren't working better than placebo. If some of these studies are showing that the placebo effect is actually growing and more people are feeling better simply after taking a pill.
Okay, we have time for one more question. Before we get to that last question, there are a lot of questions that we're getting about people wanting to wean themselves off of benzos.
Oh, yeah. Okay, let me tell you something about that. There is a website called Benzo Buddies. And this was a website started by a man who was taking benzodiazepines for a seizure disorder and ended up realizing that he had created anxiety problems for himself when he didn't have anxiety problems. And he's just an amazing man, created this website. It's an international website called Benzo Buddies, and they are a source of all kinds of useful information. And they like to help and support people. It's very hard to find physicians who are experienced in the United States, at least. You know, they're ahead of us in England and Australia, but in the United States, it's hard to find very many physicians who understand how to gradually taper people off benzodiazepines. So if you're interested in that, check out that Benzo Buddies site. Also, you know, search for doctors. I think on that site they have some information about doctors who do work with people. You really need to work with a doctor. This is not something you should be doing on your own, and it is a very slow process.
And, you know, I think out of all of the psychotropic drugs, benzodiazepines are one of the more dangerous ones to wean off of. So I would encourage people, even with that tool online and that information, to take that to your prescribing physician or your psychiatrist to assist you with.
You definitely need a physician. You need a psychiatrist and someone who knows what they're doing.
Yes. Okay. Well, unfortunately, we didn't get to all of the questions. Dr. Pittman, can you just repeat your email, please?
I sure will. If you want me to answer your questions, send an email to cpittman, Pittman, at St. Mary's, and you have to spell out the Saint, St. Mary's, MARYS, .edu. And you can send your question to me, and I will really try to respond to you. And I'm not a physician, I'm not a psychiatrist, but I really have talked with and worked with many people dealing with these issues and can give you the benefit of my experience and try to direct you in the right direction.
And if you didn't hear that email address, you can always find Dr. Pittman on the Find a Therapist section of the ADAA.org website.
And many other good therapists.
Yes. Thank you so much, Dr. Pittman. This was a very informative webinar, and thank you all for attending this webinar. We didn't get to all of the questions. We hope this was helpful, though, and please let others know about this series and consider making a contribution to ADAA. Thank you so much.